how do you counsel patients who might be having emotions around their gynecologic cancer? What advice and resources are available?
Yeah, so I think that a cancer diagnosis is a life-changing experience. Even for patients who have early stage cancers, hearing that word cancer on the phone, in the doctor's office, and having to be the one to then tell family members and understand what that means for their life is truly a pivotal moment. And it does bring up all sorts of emotions and need for support. So what I would say is, first and foremost, it can be really common that cancer patients sort of retreat into themselves and want to be more private. I think that I would encourage people to really use their support networks that they have. Everyone's different, and so I definitely want them to do what feels right for them, but making sure that you leverage whatever support networks you have in your life is sort of the first foundation. Second, I think that there are just so many excellent resources out there for patients facing a cancer diagnosis. Certainly in endometrial cancer, there are our big kind of national groups of physicians. We put out a ton of information that is patient focused. So that is at a level that patients can understand. The kind of two that I think of are the Society for Gynecologic Oncology is a big resource for patients with gynecologic cancers. And then the kind of overarching Cancer Society, ASCO, is another place that has a ton of cancer resources. I also think that patient support groups can be really helpful. There are many, sometimes, so my institution has one that is kind of more specific to our institution as part of our institutional branch of the Woman to Woman program. There are also national or city or state cancer support groups. And I think that those can be really helpful to gain mentorship from someone who's been through it, from someone who is kind of a little bit further along in their journey than you might be, as you know, the patient that's just getting a diagnosis, for example. And that can be really helpful so that you have that bird's eye view that sometimes right after your own diagnosis, you just don't have the perspective to understand.